And question number 5, Monica Lennon.
Thank you. To ask the Scottish Government what action it is taking to improve support for women who have lipoedema.
Minister Joe Fitzpatrick.
The Scottish Government recognises that lipoedema can be a distressing and painful condition. As with all long-term conditions, we want people living with lipoedema to be able to access the best possible care and support. Lipoedema services are mainly provided by therapists, including nurses and allied health professionals who are based in lymphoedema services available in every health board in Scotland. Over the last 3 years, we've worked to improve lymphoedema services via the National Lymphoedema Care in Scotland Working Group.
Monica Lennon.
I thank the Minister for his reply. Anne Henry, who I've been working with for over a year now, went public about how difficult it is to get a diagnosis for lipoedema on the NHS. Following a private diagnosis, Anne has faced a battle to get NHS treatment. There is only one surgeon in the NHS in Scotland who can perform the surgery she needs. Anne was due to have surgery in Ninewells Hospital next month, but she's been told to expect a delay because of staff capacity issues. Last month, the Minister made a call. He told me there is no demand for a second surgeon, but Spice advised that over 250,000 women in Scotland have lipoedema. Can the Minister explain why one surgeon is sufficient? Will he look at the capacity issues again, and will he meet with me in the new year to discuss ways to improve lipoedema healthcare?
Minister.
Obviously, I was pleased to hear that the member's constituent has got an appointment going forward. I hope that takes place in a timeous manner. Liposuction is not necessarily the best and appropriate treatment for everyone with lipoedema. So while there are the numbers that the member suggested in terms of people with lipoedema, that doesn't mean to say that number of people that is the best treatment. And clearly that's a discussion between the clinician and the patient to decide what the best treatment is for. Dr Alex Monagh is the leading surgeon who performs this specialist treatment, performs it in Dundee, and I think there is a real danger that if we had more surgeons performing that particular surgery, then they wouldn't be able to maintain their skill sets in terms of the terms, the demand for that service. And that would be something that I think that would really send alarm bells ringing for me if we were potentially having a number of surgeons who weren't managing to keep their skill set up to date. But of course, I'm happy to meet with the member to discuss these matters in the new year.